nutrition coach and a yoga instructor. I'm very happy to meet you all through the eGlobalDoctors platform. eGlobalDoctors platform is where there are so many specialists and coaches who are ready to help people to get relieved of their pain throughout the globe virtually. So today the topic which I'm going to talk about is all about parathyroid gland, its hormone, and what happens when it's in excess and when it's low. So the parathyroid glands are generally a small piece-sized glands located in the neck just behind the thyroid gland. The parathyroid glands produce a hormone called parathyroid hormone or parathormone or simply PTH. Though it has got a similarity in name with thyroid gland, this gland is entirely different. The two parathyroid glands on each side, which are positioned higher, are called superior parathyroid gland, while the lower two are called inferior parathyroid gland. The parathyroid glands are important in tightly controlling the calcium levels in the bloodstream. Because of this gland, calcium levels are generally very stable. So this is very important to ensure that the nervous system and the body's muscles work properly, and also the bones remain stronger. The main target are organs where this parathyroid hormone has its effect are the bones and the kidneys. When the calcium levels are low, parathyroid hormone is released by this gland into the blood and causes the bones to release calcium and increases the levels in the bloodstream. It also causes the kidneys to stop calcium being lost in the urine, as well as stimulating the kidneys to increase the vitamin D metabolism. If, for example, if a person doesn't take enough calcium through the diet and doesn't have enough vitamin D, the circulating calcium levels fall, and the parathyroid glands produce more parathyroid hormone. This brings the calcium levels in the bloodstream back to the normal. So another method that the parathyroid hormone uses to increase the calcium levels in the bloodstream is activation of vitamin D. This occurs in the kidney. Um, so the activated vitamin D then increases the calcium absorption from the gut. When this parathyroid gland creates high amount of the hormone in the bloodstream, there results a condition called hyperparathyroidism. There are three types of hyperparathyroidism: primary, secondary, and tertiary. In primary hyperparathyroidism, an enlargement of one or more of the parathyroid gland causes overproduction of this hormone. This causes high calcium levels in the blood, which can cause a variety of health problems. In secondary hyperparathyroidism, the overactivity of the parathyroid gland occurs in response to another disease condition that causes calcium loss. Generally, the parathyroid overactivity is an attempt on your body's part to keep the calcium levels normal. Some of the conditions that lower calcium levels include kidney failure, severe vitamin D deficiency, and severe calcium deficiency. Tertiary hyperparathyroidism occurs when an excess of parathyroid hormone is secreted by parathyroid gland, usually after a very long standing secondary hyperparathyroidism. So let's see what are these symptoms. Some of the symptoms are joint pain, muscular weakness, then feeling tired, depression, then having trouble in concentrating, loss of appetite, nausea, vomiting, confusion, forgetfulness, then increased thirst, and as a result, need to urinate frequently, then constipation, bone pain, reduced kidney function, formation of kidney stones, osteoporosis, and even high blood pressure. Then, as far as the nutritional intervention is considered, It's always good to avoid all potential food allergens. Then eat calcium-rich foods, including almonds, green leafy vegetables, milk and milk products. Then completely avoid the refined foods. Then always use healthy cooking oils. Avoid trans fatty acids and avoid carbonated beverages because these contain high amounts of phosphates, which leads to calcium leaching from the bones. Avoid caffeine, alcohol, tobacco. Drink at least 6 to 8 glasses of water and exercise moderately, 30 minutes a day for 5 days at least 5 days in a week. Then, when there is a condition called hyper, then obviously there would be a condition called hypo. So, hypoparathyroidism. So, this occurs when the parathyroid gland doesn't produce enough parathyroid hormone. So, so little parathyroid hormone causes abnormal levels of calcium. The symptoms of hypoparathyroidism can include tingling sensation in fingertips, toes, and lips, then twitching facial muscles, feeling muscular pain or cramps, particularly in leg, feet, or tummy, tiredness, mood swings, such as feeling irritable, anxious, or depression, dry, rough skin, coarse hair that breaks very easily, and fingernails that break easily. As far as nutritional interventions is considered, it's always recommended that the person follow high calcium, low phosphorus diet. Vitamin D is also necessary for calcium homeostasis, and for some, they might need magnesium supplementation also. Finally, though the parathyroid gland is just a pea-sized, it plays a vital role in calcium and vitamin D homeostasis in our body. Thereby, proper functioning of all the body organs is ensured. I'm very happy in meeting you all, and thank you everyone for this opportunity. So let's meet again in another session.